Chairman, we're ready to begin.
Thank you, Denisha. Would you please call a roll?
Yes. I'll begin with Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Cynthia Rucker,
I'm here.
Russ Childers, Russ Childers. You
I'm
may be
here.
on.
I'm
Thank-
sorry. I was having trouble unmuting.
Thank you. Nelva Lee,
Here.
Kenneth Davis.
Here.
That concludes my roll call, Chairman.
Thank you, Denisha. That is a full complement of board members, and thank you so very much for taking your time to attend and participate in the board meeting this morning. Welcome all of our listeners here. We will not have a hearing impaired interpreter today. We were not able to secure one, so hope that's not inconvenience to people. We do, as I say, we do have a quorum, and we'll call the meeting to order. Our agenda this morning, we will be asked as a board to consider for final adoption 4 different presentations that we will have on our agenda today. First of all, I'd like to call on our secretary, Russell Crutchfield, concerning the approval of the minutes of the February 10th meeting, and ask Russell if he's had a chance to review those minutes and can recommend them for approval.
Well, thank you, Mr. Chairman, and good morning. I have reviewed the February 10th board meeting minutes and found them to be correct and in order, and I move that we approve the February 10th Board of Community Health meeting minutes.
Is there a second to that, please?
I second. Nelva Lee.
Delvin Lee has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, the minutes are approved, and thank you very much. With that, next on the agenda item, I'll turn it to Anthony Williamson, a chairman of our Care Management Committee. And he has a presentation concerning the committee charter, and we'll be asked to, as a board, if we would approve that, I believe. Anthony, please go ahead.
Thank you, Chairman Boyd. Yes, we are presenting a new Care Management Committee charter to the board this morning for approval. Hopefully everyone has had an opportunity to review this. It's a fairly brief document, but it does outline the role of what the committee's function is. And that function is really to assist our larger board committee in doing its duties by hearing more detailed reports about care management functions and those related quality efforts within the department. We understand that what our committee responsibility is, and it also outlines, what are necessarily not our responsibilities. It speaks to us meeting quarterly, unless we need to, meet more often. We'll hear reports from the department, and we will bring those reports back to the larger board so that they can be greater informed of these initiatives. So I'd be happy to answer any questions if there are any on the charter this morning. But essentially this describes the purpose of the Care Management Committee and would ask for your approval.
Thank you, Anthony. Are there any questions or comments from the board, please? I've had a chance, as the other board members have as well, I'm sure, to review the proposed charter, and thank you, Anthony, and your committee for bringing this forward. If there are no questions or comments, is there a motion for approval?
Roger Folsom, so moved, Mr. Chairman.
Mr. Folsom has moved that it be approved. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing
Second,
none. I'm sorry. Was there someone abstaining?
no, I was seconding this.
Oh, okay, thank you. With that, it is approved, and thank the committee again for bringing that forward. Next on our agenda is the commissioner report. I'll turn it over to Commissioner Noggle.
Good morning. Thank you, Mr. Chairman. Good morning, members of the board. As the chairman mentioned, our agenda today is pretty straightforward. 4 final adoption items that the staff will present, and several of them had a fair number of public comments received, but all were very positive. So looking forward to reviewing those with you today. The House released their FY23 budget recommendations this morning, and just want to thank them for their effort and work with the House Budget Office. There are a lot of great items in this budget. They continued support of many of the items that the governor had recommended, and went further and added some additional items. The net change so far, and we've just been kind of combing through it for the last hour, is actually about a reduction of $154 million in state funds. That's due to an extension of the public health emergency and the need for fewer state funds for the first quarter, as that increased FMAP will continue for another quarter, or at least we anticipate it will. But lots of those other funds have been shifted around to implement new health initiatives and several other payment and provider rate increases. All that to say, you know, I think my next budget hearing is Monday morning with the Senate. We'll see how that ultimately looks in a final adopted budget when we get to the end of session. But ultimately, I would think the board should plan for much more robust board meetings in April and May, as we will begin to tee up some of those items for initial and final adoption, so that we get ready to implement those things in a timely manner moving into the FY23 year. And other good news, we did get final CMS approval of our Appendix K, which includes a rate increase for some of our providers for our now and comp waivers, which is great news. We had been waiting for that. We also began implementation on the provider module in our MEST Medicaid Enterprise System Transformation module, and then we're continuing those other procurements, moving on down the line with those. Couple of milestones and staffing updates that I always like to share. We have a new general counsel by the name of Paul Norman, who'll be joining us. His first day will be next week. And you may remember that we had several other changes happening in retirements. Stacy Hillip from our health planning division has been designated as my new CON, or certificate of need designee. And Carisha Lang from the health planning unit has been promoted to the interim executive director. And they have both been with the department for many, many years. So proud of them, and grateful that they have both agreed to step up and take on new responsibilities. And then, as I always like to do, I just want to recognize some other staff milestones. Javon Woods and Anita Hicks are both celebrating 5 years of service. Sybil Henderson, Carla Morris, and our own Mario Ellis, our chief of staff, are celebrating 10-year anniversaries, and Alton Meeks is celebrating 30 years of service with the department and the state. So thank you, forever grateful for their service and all that they do for the state, serving Georgians and the department. Happy to answer questions, Mr. Chairman, but that would conclude my report.
Thank you, Commissioner. Are there questions or comments for the commissioner, please, from the board? Thank you so much for that comprehensive report, and we'll look forward to working a little harder in April and May. Okay. With that, we'll move into our next agenda item, and the beginning of the 4 items that we'll be asked to consider. And I'll call on Brian Dowd to make his presentation regarding medical plan assistance.
Thank you, Mr. Chairman, Commissioner, members of the board. Today, I am presenting for final adoption a rate adjustment for psychiatric residential treatment facilities, or PRTFs. At the February board meeting, we proposed for initial adoption an amended notice for rate adjustment for PRTFs. The amended notice followed initial notice presented in the January board meeting and subsequent public comment. DCH proposed at the February board meeting to amend the PRTF rates based on facilities submitted 2020 audited cost reports in 2 parts. The first part was in accordance with the Behavioral Health Policy Manual for PRTF coverage, and the second part was in accordance with the co-occurring Behavioral Health and Autism Spectrum Disorder Policy Manual for PRTF coverage. DCH proposed removing cost ceilings associated with the PRTF rate setting and implied a 5% inflation factor to the Behavioral Health Part 1 rates. Hold harmless provisions in the state plan were proposed for any facility that experienced a significant decrease in rates. The proposed effective date for the change pending DCH board final adoption and CMS approval will be January 14th, 2022. An opportunity for public comment on the proposed amended PRTF rates was held February 16th, 2022 at 11 a.m. via WebEx. Written comments were due on or before August 23rd, 2022. We received no oral comments from the public hearing. We received one written comment on the amended proposed change. The written comment was from Cheryl Dresser with the Georgia Alliance of Therapeutic Services. Ms. Dresser thanked DCH and the board for amending the rate adjustments in response to initial oral and written comments that were submitted. Ms. Dresser noted that the amended public notice demonstrated the viability of the public notice process and looked forward to the board's final adoption of the PRTF rate adjustment. At this point, I would pause if there was any questions and would respectfully request your final adoption of the amended rate adjustment for psychiatric residential treatment facilities.
Any questions, comments from the board, please, for Brian? Hearing none, is there a motion for approval for final adoption?
Melva Lee, I so move that we approve.
Has moved for approval of final adoption. Is there a second?
Ken Davis, second.
Dr. Davis has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much.
Thank you, sir.
Next on our agenda, Ryan Loki, our Deputy Commissioner and Chief Health Policy Officer, will make his presentation regarding medical assistance plans.
Great. Thank you, Mr. Chairman, members of the board and commissioner. Good morning. You'll recall that at our February board meeting, I presented the first in what we're proposing in a series of supplemental and directed payment programs for our hospital partners in this state. This one, the first one that we're calling Advancing Innovation to Deliver Equity. You'll recall that this is a new and an innovative supplemental payment program that is limited at this time to just two types of hospitals, either state-owned acute care hospitals or hospitals that are non-state governmental, individual acute care hospitals that are providing more than 63,000 total Medicaid inpatient days based on the 2020 Medicare cost report and has over 100,000 total in-state Medicaid inpatient days as reported in the 2021 DCH DISH final payment eligibility report. Effectively, this proposal, Mr. Chairman, you'll recall, limits this to just Grady Health System and Augusta University Health System. We also discussed our February board meeting that in the coming months, likely at our April board meeting, that Brian Lipton and Kim Morris and a couple other folks are going to be presenting the next phase of this that expands to a whole bunch of other hospitals as well. And I look forward to them presenting that for initial adoption to you guys. As the commissioner mentioned, we did receive a fair amount of public comments in support of this, and I'll just read off real quickly those who shared positive public comment with us. That included the American Cancer Society Action Network, Candler County Hospital, the American Diabetes Association, Grady Health System, Hometown Health, the Georgia Hospital Association, and the Augusta University Health System. And all of those comments were positive and in favor of the proposal, and we appreciate their support with that. At this time, Mr. Chairman, I respectfully request the board support for final adoption of the Advancing Innovation to Deliver Equity Supplemental Payment Program. And we'll answer any questions if there are any.
Thank you, Ryan. Are there any questions, comments from the board? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Roger Folsom has moved for adoption, and is there a second?
Russ Childers, seconds.
Childers has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Ryan, thank you very much.
Thank you, sir.
Next, Tricia Berkeley, our interim executive director of Office of Health Planning, will make a rules and regulation presentation.
Good morning, Chairman Board, Commissioner Noggle, members of the board. The Office of Health Planning presents rules today for final adoption. These rules are found in Chapter 111-2-1 of the Department's Rules and Regulations and are necessary in order to reflect legislative amendments to the State Health Planning and Development Act, to correct grammar, and to provide clarity and to modernize the rules. You will recall these rules were presented at the January board meeting for initial adoption. A draft copy was provided to you. I will review the changes as follows. The proposed changes make updates to the functions of the Office of Health Planning to include references to utilizing technical advisory committees to prepare and revise a draft state health plan, to seek advice from technical advisory committees at the department's discretion, to provide for a fee exemption for a certificate of need application filing by a rural county hospital, and to study, recommend requirements for, and track the amount of uncompensated indigent and charity care required by each type of healthcare facility. The proposed changes include empowering the commissioner to establish and abolish technical advisory committees in consultation with the board in order to inform effective strategy development and execution. A public comment hearing was held on February 15th, 2022, and written comments were due on or before February 18th, 2022, which was extended until February 25th, 2022 to mitigate any issues associated with an email address error published in the department's public notice. No oral comments were received. The sole written comment was received from Carrie F. Conley, General Counsel and Senior Vice President of Healthcare Policy with the Georgia Hospital Association, GHA, and was provided to you. To summarize, the GHA recommends that the department define the term rural county as it is defined in OCGA section 31-6-232, and to define the term healthcare facility as it is defined in OCGA section 31-6-217, since proposed rule 111-2-1.022H exempts hospitals in a rural county from any certificate of need application fees, and proposed rule 111-2-1.022K adds to the department's functions the study of the amount of uncompensated indigent and charity care provided by each type of healthcare facility. In response, the department declined to revise proposed rule 111-2-1 in sequence as it pertains to a definition of rural county and healthcare facility. These terms are already defined in the proposed revisions to rule 111-2-2 in sequence, and is under those rules that these terms have practical application as it relates to certificate of need application fees and indigent and charity care commitments. Specifically, rural county is already defined in proposed rule 111-2-2.0152, and the definition of healthcare facility as reflected in House Bill 186 is captured in proposed rule 111-2-2.0128. The department is requesting consideration of these rules for final adoption today. Now I'll be happy to answer any questions regarding the proposed changes.
Thank you. If I understand, the bottom line is the answer to the written comment and request for definition was your answer is not necessary because it's already defined.
That's correct.
Is that the bottom line?
Yes.
Okay, thank you. Are there any other questions or comments from the board, please? Hearing none, is there a motion for adoption for final approval?
Motion for adoption, David Cruz.
Cynthia Rucker, a motion.
It has been, motion has been made for final adoption and seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. You may move on to your next item. Thank you.
Thank you. For the next agenda item, the Office of Health Planning presents for final adoption revisions to the rules found in Chapter 111-2-2 of the Department's Rules and Regulations. The revisions are necessary in order to reflect legislative amendments to the State Health Planning and Development Act to correct grammar and to provide clarity, as well as to modernize the rules. As you will recall, these proposed rules were presented at the January board meeting for initial adoption. A draft copy was provided to you. I will review the key changes as follows. The proposed changes make updates to the health planning regulations so as to revise provisions related to certificate of need requirements, to revise and provide for new definitions relative to health planning and development, to prohibit certain actions relating to medical use rights, to revise provisions regarding when a certificate of need is required, to authorize destination cancer hospitals to be converted to general cancer hospitals, to revise and provide for additional exemptions to certificate of need requirements, to provide for requests and objections to letters of determination that an activity is exempt or excluded from certificate of need requirements, and to provide for annual reports to be made publicly available. Additional changes are proposed to allow for electronic filing. A public comment hearing was held on February 15th, 2022, and written comments were due on or before February 18th, 2022, which was extended until February 25th, 2022, to mitigate any issues associated with an email address error published in the department's public notice. No oral comments were received. The sole written comment was received by Carrie F. Conley, General Counsel and Senior Vice President of Healthcare Policy with the Georgia Hospital Association, and was provided to you. To summarize, GHA recommended 4 amendments. First, GHA recommended adding the phrase "or as directed by the department" wherever the proposed rules require submission via the web portal, in order to avoid challenges as to whether a document was received prior to the statutory deadline. A further recommendation was made to either revise the rules or post additional instructions on the portal to address a scenario when the web portal is not available. In response, the department states as follows: to avoid confusion and to streamline processes by ensuring there is a single method for document submission, the department proposes to add the recommended the department declines to add the recommended language. In terms of a contingency plan for the rare occasions when the web portal is unavailable, filers should send timely submissions along with a screenshot showing the unavailability of the web portal to ohp.help@dch.ga.gov for handling. The date and timestamp of such email will serve as the filing date and timestamp. The department's website will be updated to reflect these instructions. I will pause for any questions related to this first recommendation and the related response.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Cynthia Rucker, a motion approval.
The record has made a motion for approval. Is there a second?
Russ Childers, seconds.
Russ Childers has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, they are approved. Thank you so very much.
There were 3 additional recommendations.
Okay, please proceed.
Okay, thank you. So secondly, GHA recommended that the proposed rule 111-2-2-.064D be revised to reflect the certificate of need application fee exemptions for hospitals in rural counties. In response, the department declined to include the certificate of need application fee exemption for hospital and rural counties in proposed rule 111-2-2-.064D because this exemption is already reflected in proposed Rule 111-2-2-.022H. The department will, however, update its certificate of need application to include a checkbox for hospitals claiming the fee exemption. I will pause for any questions related to this second recommendation and the related response.
Any questions, comments? This will require another vote, is that correct?
One vote at the end.
One vote at the end, okay, please proceed.
Okay, thank you.
Sorry, I interrupted you earlier.
No, that's okay, that's okay. Third, GHA advances that since House Bill 186 provides a certificate of need exemption for the restructuring or acquisition of all types of hospitals, the department should delete proposed Rule 111-2-2-.065F, which requires applicants for a certificate of need to submit additional documentation if the application involves the acquisition of certain hospitals. In response, the department declines to delete proposed Rule 111-2-2-.065F since it contains references to statutes that have not been repealed, specifically OCGA Section 31-7-5-53C and OCGA Section 31-7-57D. Further, proposed Rule 111-2-2-.065F states that additional requirements shall be in effect where the application involves the acquisition of a hospital owned or operated by or on behalf of a political subdivision. Any combination of such subdivisions by or on behalf of a hospital authority, emphasis added. On the other hand, the exemption under OCGA 31-6-47A9 is for the expenditures for the restructuring or acquisition of existing healthcare facilities and is already reflected in proposed Rule 111-2-2-.0310, consistent with House Bill 186. I will pause briefly for any questions.
Any questions, comments from the board, please? Hearing none, or you?
Okay.
I proceed.
For the fourth and final recommendation, GHA recommends the language in proposed Rule 111-2-2-.07 1G.1 regarding who is eligible to oppose a certificate of need application be added to proposed Rule 111-2-2-.081 regarding the review process for batched certificate of need applications. In response, the department declined this recommendation since proposed Rule 111-2-2-.07 1G.1 already makes clear that no party may oppose an application for a certificate of need unless that party meets the listed criteria. Further, proposed Rule 111-2-2-.07 1G.1 states overarching certificate of need application requirements. I will pause for any questions specific to this fourth and final recommendation and the proposed response.
Any questions, comments?
Okay, the department is requesting consideration of these rules for final adoption today, and I will be happy to answer any overall questions regarding the proposed changes.
If there are no questions, we'll try this one more time. Is there a motion for approval for final adoption?
Motion for approval, Cynthia Rucker.
Ken Davis, second.
And Dr. Davis has seconded. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, they are approved. And thank you so very much. And thank all the presenters and particularly you for the work that you did on this. As we go through it, I know there's a lot of work went on in the background, and thank you for having it to our board members a week in advance. So we've all had a chance to review this material in advance, and that's always appreciated.
Thank you.
Thank you. With that, I will ask if there are anyone know of any new business that needs to come before the board at this time, or any comments from the board. Hearing none, the meeting is adjourned. Our next meeting will be in at 10:30 a.m. on April 14. And thank you also very much this morning for participating. Thank you.
Thank you.